Oh, this is a good angle. I'm going to send you this one. This is actually a really good one.
Okay.
This is perfect.
It's going to change things just a bit, but let's jump into Ronald Koeman's mind a bit as we look back at that collision. Where would you see Elias stepping in, Jamie?
All right, we're back. So we're going to talk about Luis Vazquez's injury in El Clasico about a week ago. So as you can see from the video, he was making a play, and Sergio slid into him, banged him in the front of his his knee, not actually his knee, just below the knee, the tibia, this part right here. So I saw that and said, this guy probably has a PCL injury, and lo and behold, that's what he has. So the posterior cruciate ligament is a ligament that goes from the there's a ligament that connects the tibia and the femur, right? And it's that ligament there, right? So that ligament prevents the tibia from translating posteriorly. It usually gets injured in a car. They call these dashboard injuries. So if you're sitting in the car, like you're in the car sitting like this, your knees bent 90 degrees, you rear end somebody, your knee is going to go forward, hit the dashboard, and hit that tibia, push it backward, and injure the PCL. Okay, so it can either stretch it, partially tear it, or completely tear it, and it's out. Now, the interesting thing about these injuries is quite often is that people can survive, or they can be functional without a PCL. They can survive without PCL, yes, they certainly can. They can be functional without a PCL. Okay, so the other mechanism that's a contact mechanism. So a direct blow to the anterior knee. The other thing the other way this can be injured is if the knee is hyperflexed, a non-contact injury, and the foot is plantar flexed. In other words, the toes are pointing down. Okay, and you just fall, right? What happens there is you have again an injury to that, a force to that tibia, pushes it backwards, injures that PCL. So the interesting thing to look at this video is that Vasquez is on the ground sliding. He's going like this. Sergio hits him right here. So I guess it is kind of a contact injury. He hits him, but he's also hyperflexed. It probably makes the injury, which I would have expected to make the injury even more so. But it turns out he just has a sprain, which is a good thing. Okay. So the way you diagnose PCL injuries is, one, you have to know the mechanism. They're going to have pain, posterior knee. Second is you do a couple of tests, right? So one of the tests is called the posterior draw sign, and it's the most sensitive. So you bend the knee to 90 degrees, right? So the patient's going to be on the table with their knee like this, and you just put posterior pressure on the tibia, and if it goes back, a centimeter and a half, that's a posterior cruciate ligament tear, or as the Russians like to call it, a posterior cruciate ligament tear. Anyway, the other test is just what's called the Sag test. So you have the person bend their knee 90 degrees again, and you just see if that tibia translates posteriorly or sags down like this. Okay, that's called the Sag test. That's if the PCL is completely gone, right? So that's it's torn. Finally, third test you can do is called the quad active test, right? So quad active test, you have the person do the same thing. So you have them do this, right? Bend their knees to 90 degrees. Their tibia is sagging, okay? And then you have them fire their quads, right? And if you see this happen, that shows you that the PCL was injured, right? Because the quadriceps are going to pull that tibia anteriorly. So now that you've seen that, how do they treat this? So the rehab for this is quadriceps strengthening exercises, right? Because that quadriceps is going to keep that tibia from translating posteriorly. So they strengthen the quadriceps. In individuals where they have a bony avulsion, in other words, where the PCL has has ripped off the bone, there's a bone fragment attached to it, or grade 3, right? That's when you do surgery and you repair those. Reconstructing the posterior cruciate ligament doesn't have the best results. And often they just don't do repair unless you've had an injury that has involved multiple ligaments around the knee. So in particular, if you have an ACL, PCL, if you have an injury to the posterior lateral complex, which is a bunch of ligaments, that's a really serious injury. Those are operated on. But most PCL, posterior cruciate ligament injuries, are treated non-operatively with physical therapy and quadricep strengthening.
Is that just because access to it is so hard unless you've torn other ligaments, or is it
Well, like
small?
well, no, it's again, it's because you can function. Well, if it's a grade 1 or grade 2, you can strengthen the quadriceps, and the person's going to do fine. Now, if that in a PCL deficient knee, in other words, PCL's gone, what happens over time is the person gets a little bit of, well, not a little bit, they develop arthritis in their knee, and it's on the inside, the medial portion of medial compartment of the knee, and in the patellofemoral compartment, so between the femur and the patella, underneath your kneecap. And it happens on the medial side because when that PCL is gone, you're in a little bit of varus, which is what's also known as being bow-legged. So a little bit of varus. You can see that there's more pressure on the medial compartment when you're varus. That's why you wear this out. And then the biomechanics are just off, so you'll wear out the joint, the patellofemoral joint, faster. He is going to be out for the rest of the season, but he's leaving Madrid anyway, Real Madrid anyway.